My name is Angela Hong. I'm a radiation oncologist with expertise in the management of patients with bone and soft tissue sarcoma. I'm also the co-chair of the Scientific Advisory Committee for the Australian-New Zealand Sarcoma Association, which is a not-for-profit organisation with a goal of improving the treatment outcome for patients with sarcoma. Sarcoma is a group of cancer started in either the bone and soft tissue. It's a relatively rare form of cancer diagnosis. In adults, 1% of all cancer diagnosis is sarcoma. However, in children, it's about 20% of all cancer diagnosis. So overall, it's not a common cancer diagnosis. And within the sarcoma group, there's about 70 different subtypes of sarcoma, depending on where they arise from, whether it's from the bone or from the soft tissue, and what they look like under microscope. So sarcoma is a very broad term and refer to a very diverse type of cancer. In terms of the incidence, for soft tissue sarcoma in 2023, there were 850 new cases in Australia, and the mortality in terms of the survival is about 70% at 5 years, depending on the exact type of sarcoma, the size and location and stage at the time of diagnosis. In 2023, about 650 patients died from soft tissue sarcoma. Sarcoma or soft tissue sarcoma is cancer start in the soft tissue, so either the fat layer, the muscle, the blood vessel, or nerve ending. So it's very broad term. It represents 1% of all cancer diagnosis, and the common site for soft tissue sarcoma is the limbs or arms and leg or around the shoulder and hip region. But soft tissue sarcoma can happen in any part of the body, including internal organs as well. So the trial that we are very excited about is the SCK032 trial, which is a phase 2 randomized international trial for patients with localized soft tissue sarcoma of the extremity, so for patients with more than 5 centimeters in size, and specific subtype of sarcoma called either grade 2 or grade 3, dedifferentiated liposarcoma or undifferentiated pleomorphic sarcoma. Localized disease, meaning no spread elsewhere. The standard treatment protocol for this type of patient is radiotherapy in combination with surgery, and that will provide a very high chance of local control, about 90%. But the problem we face in this group of patients is the spread elsewhere. About 50% of the patients with more than 5 centimeter high-grade sarcoma of the limb will develop metastatic disease. And at the moment, there's not a lot of effective treatment when patients have metastatic disease. So this trial looked at the addition of immunotherapy, anti-PD-1, pembrolizumab, in conjunction with radiotherapy. So in the preoperative setting, they have 3 cycles of immunotherapy in combination with radiotherapy, surgery, and then further immunotherapy for a total of 1 year. So randomized trial, so half of the patients have the immunotherapy, half just have the standard treatment of surgery and radiotherapy. International study, we recruited about 140 patients, and Australia is part of this international study. The finding was presented a couple of weeks ago at ASCO, and that showed a significant benefit in patients who had the immunotherapy in terms of less chance of the sarcoma coming back anywhere in the body or less chance of dying. So the improvement in the disease-free survival 2 years from about 53% to 70%. The Australian-New Zealand Sarcoma Association collaborated with the US-based group SARC, which is a not-for-profit organization in the US for sarcoma research. ANZSA is the local sponsor for 3 sites in Australia, so in Brisbane, in Sydney, and also in Melbourne. There were 18 recruiting sites around the world, including US, Italy, Canada, and Australia, recruited to this study. Australia actually contributed significantly to this trial. Overall, we recruited 30% of the patients to this study, and that's a big commitment from the Australian-New Zealand Sarcoma Association. And it's good for a patient actually able to participate in this study, because outside the trial setting, they are not able to get immunotherapy because it's not a proven benefit. So we're very pleased with that. We are still following up the patient on this study. We're waiting for a longer analysis in terms of the survival. We're also doing a lot of laboratory-based study, looking at the actual tumour, see whether we can identify patients who are likely to develop metastatic disease or more likely to benefit from immunotherapy. So there's ongoing analysis from this trial. Sarcoma is a rare cancer. It's not easy to conduct a high-quality randomized trial. I mentioned to you 140 patients, and that's recruited over 5 years from 18 sites around the world. So it's not easy to conduct another study. But this is the beginning in terms of using immunotherapy in selected patients with sarcoma.